Hello everyone, my name is Anuradha. Today I'm going to talk about cognitive behavioral therapy or interventions. Agenda for today is why dive into behavioral therapies, what are some of the tools, principles of cognitive behavioral interventions, how you can use it in CBT with the learners. I'm going to speak about different techniques of CBT. Then we're going to talk about a session plan, how to review and monitor the progress, and then we are going to talk about the two articles which are chosen for the semester, and then in the end I'm going to give you some of the internet resources which can be helpful for the caretakers and learners. So people go through growth and development stages both in their mind and body, and different organizations have specific guidelines for what these stages should look like. So if someone like a child does not meet these standards, we might use behavioral interventions to help, and also for addressing mental health condition, behavior modification, overall being, we can use behavioral. There are multiple tools available in behavioral toolbox which we can use across behavioral therapies. Thought bubbles. We all know thoughts are powerful. So cognitive interventions like cognitive behavioral therapy helps us reframe tricky thoughts into positive ones. Visual aids are like a superhero goggles. It helps us visualize our day's plan, routine, and activities. Social skills map is the navigating social situations through social skill training. Uh, it guides us, building friends, relationships, and conversations. Practice pad is like a game controller. Just like a game, practicing social skills and new behaviors helps us level up. Relaxation portion is used when we are feeling stressed, anxious. So there are some relaxation techniques like deep breathing, uh, uh, helps us manage our emotions. CBI is an evidence-based intervention. I'll quote the definition from the Upper Model website. CBI is based on the simple principle that thinking, which is an internal behavior, impacts emotion, feelings, and controls overt actions, which is our external behavior. Therefore, CBI programs individuals learn new skills and new ways of thinking that can lead to changes in their emotional state and in their behavior and actions, and ultimately affect their conduct. So here in the diagram you can see what you think affect your what you feel, and what you feel affect your behavior and actions. CBI program uses a combination of approaches to increase the learner's awareness of self and others, and this can be coupled with the teaching of social skills to assist the learner with interpersonal skills, and may incorporate other evidence-based practice. CBT is widely used to treat a variety of mental health issues and disorders, and here are some of the disorders and issues which is CBT, where CBT is effective. So, like anxiety, depression, obsessive compulsive disorder, post traumatic stress disorder, eating disorders, etc. CBI teaches learners to examine their own thoughts and emotions, recognize when negative thoughts and emotions are escalating in intensity, and then use strategies to change their thinking and behavior. So, psychoeducation is for emotions such as anxiety, sadness, and anger. The effective education component addresses why we have emotions, advantages and disadvantages of emotions, identification of different level of emotional expression in oneself and in others. So it's like a guidebook. Psychoeducation helps understand ASD better. For gradual exposure, it involves the development of hierarchies of anxiety provoking situations, and starting with reasonably low intensity target first. For example, facing fears step by step. It's like leveling up in a cognitive restructuring involves teaching individuals to recognize and correct thoughts that may be distorted through examining the evidence of for these thoughts and then creating new perceptions. The affective recognition is like for emotions and feelings can be an abstract concepts for some. It can be helpful to clarify emotion words and definitions to try to avoid confusion. It can also be helpful to understand or incorporate the learner's own definitions or preferred terms when appropriate. For example, rather than saying that they feel what you consider very angry, a learner might naturally identify that they feel super. When we are planning for CBI, we have to follow certain steps. Step one is determine if the learner has prerequisite skills and ready to take the CBI therapy. Then we have to find out the target behavior, needs and skills, and then we have to find out the CBI interventions. We need supervised trainers, develop a session plan, prepare the materials for recording and monitoring, determine reinforcer interest, and then planning structure. This slide shows A session plan for improving sleep patterns with relaxation techniques. I'm not going to the depth because of the time constraint. These plans should incorporate the individual learning style and incorporate the interest for the positive reinforcers. Here is another example for target behavior speaking in front of the class set of steps. There are multiple tools through which we can record and monitor the progress. First one is the behavior charts. It's a visualized chart which where we can record the track the daily activities and the progress. Rating scales help gauge changes in behavior or emotions over time. This slide talks about set up smart goals which should be specific, measurable, achievable, relevant, and time bound. This article studied the parental involvement in CBT program called Friends for Life, and they assessed the parents' in-session and out-session activities and their relationship with the treatment outcome. The overall study showed that parents' negative beliefs about their child anxiety were associated with the less parental involvement. The parents with more fearful reaction to their child's physical symptoms and with more negative beliefs about their child's experience of anxiety were less involved in the therapy. Parental belief about the harmful nature of anxiety or parents' limited ability to tolerate seeing their children in distress can prompt the parents to overprotect their child and to prevent the child from confronting anxiety producing situations. Article 2 was an intervention for anxiety and problem behavior in children with autism spectrum disorder and intellectual disability. This was more tailored to individual three children, which was taken as a part of this program. And all three participants showed significant reductions in anxiety and related problem behaviors. Overall, the research demonstrated the effectiveness of a multi-component behavioral intervention in reducing anxiety and related problem behaviors in children with ASD and IDD. It also emphasized the importance of recognizing anxiety in these children and tailoring interventions to their specific needs, potentially involving a combination of techniques to achieve the best outcome. I found these three resources which are very helpful for caregivers and learners. So one is the cadenslearning.org. It has some of the exercise and materials which you can online and access freely uh, uh, around maths, words, social skills. So please explore these websites. I hope these are helpful. And then we have some references here. Thank you so much. Bye.